Hi, I'm Dr. Ryan Goodkin. Today's topic is hormone replacement therapy. We're going to focus on males today. And how dare I? How should I even consider talking about this topic, right? It's so sensitive. Like, why would you even be talking about that, right? And for most medical providers, hormone replacement therapy is high risk. That's the way they view it. And unfortunately, it's just not true. And I hate the fact that that stigma applies across the board. I see it time and again. It's unbelievable how many physicians and providers view hormone replacement therapy as too high risk, shouldn't even consider it, won't even test for it. I would sit and tell you that if you're in your 20s, from 18 to 30, and you feel great, you feel awesome, go get your numbers tested and put them in a filing cabinet, right? Or in the cloud. So just have those on file, because when you hit your 40s and your growth hormone and your testosterone and your things are plummeting and you start to feel the effects of age, we're going to ask and want to know, what would be optimal for you? What's N of 1 for you? What was your peak number? What are we trying to optimize you back to? It's not that we're trying to get you to be this muscle head that's just in the gym just making massive gains. Because quite frankly, those guys are at risk. They need to figure out and find a provider that knows how to balance those risks. Because with every risk, I'm hoping there's a benefit analysis. And so for today's discussion, we'll talk a little bit about what to look for, and how to go and find a provider that can help you. Typically, males present looking for hormone replacement therapy because of their libido. Their sex drive is just in the gutter. It's usually the main cause. There's other reasons, loss of muscle strength and tone, no energy, fatigue, malaise, just feeling of just not feeling themselves. All of a sudden, something has changed. But what's been happening is just a slow progression, just a slow change, and eventually it gets to a point where a patient needs to seek help. And so I encourage you to go out and find a provider that specializes and works in hormone replacement therapy. And I'll just give you what would probably be a typical course. Patient presents, you get a full extensive blood panel, look at into all your hormones, speak to you about your lifestyle, get your history, talk to you about your symptoms, identify what signs you're experiencing, and make a care plan. Some type of plan that addresses and aims to optimize your hormones. We don't always want to just say, go right to hormone therapy. It's not right to think that way. What is right is to think about, how did we get here? Is it environmental? Are there some exposures? Is there heavy metals? What is it? What's contributing to this decline in hormones? Besides just normal age. Can we reverse it by removing ourselves from those toxins? And then also, what can we do with nutrition and the pillars of health that we've described? Because those can also have a significant impact on your numbers. Eating a lot of processed foods, excess body fat, inflammatory diets, excessive alcohol consumption, all of these things are going to contribute to an imbalance of hormones. And so what are those hormones? We're talking about, in males, testosterone, there's progesterone, there's estrogen. Most of the time in a male that is a good candidate for hormone replacement therapy is going to be prescribed a testosterone replacement. They're going to be prescribed an estrogen blocker, because if in the event that testosterone goes a little higher, there's excess estrogen, it can convert or aromatize into estrogen. And that may look like unwanted breast development in a male. We know that would be undesirable. So they'll put that's a medication like anastrozole. That's the name of that medication. Because we're still trying to protect the endogenous production of hormones in a person, we want to encourage the body to continue to make its own. If you just piled on high doses of hormones and did nothing else, and didn't monitor, and didn't check in, the normal body's production is basically going to just shut down. It will be forever dependent upon your exogenous hormone replacement. We just don't want that. Let's try to work away from, let's prevent that. If we add on testosterone, we have anastrozole. There's another medication that's typically used, and that's to preserve the endogenous production from the testes for testosterone, which is human chorionic gonadotropin. That's HCG for short. Now, nothing's perfect. I mean, there's still risks associated with it. The idea and the goal should be to balance the hormones in an optimal range that are tolerable, that are good for the patient, and also show on the blood work. Now by doing that, you're going to have to experience just almost an immediate and fast turnaround. I mean, it does take a few weeks and some time, but you're going to immediately notice more vitality, you have greater energy, better sleep, your sex life should be improving. So all of these things, and at the end of the day, the truth of the matter is that too many prescribers and practitioners are trying to avoid it because they just don't know, they haven't been properly trained. So my advice is to seek out a top provider, somebody that has the training, someone that has the expertise. Maybe you speak to somebody that you know that's working with a doctor and get a referral. But get it checked out. At a minimum, know your numbers. At a minimum, go in and try to make lifestyle changes. We can still have an impact on the continuum of care model. I'm Dr. Ryan Goodkin. As always, I welcome your comments and questions below. Also, please don't forget to like and subscribe to this channel and follow me on social @RyanLiveGood. Thank you and be well.